Hello, welcome to Chamber Check-In. Today we are with Dr. Erin Ellis of Hope Natural Health. Dr. Ellis, good morning.
Good morning. Thank you for having me.
Thank you for joining us. I'm excited to learn how you serve women in our community and put their health as a priority. Can you share a little bit about your business?
Yes. Well, I came out to Gilbert last year in January from North Scottsdale because I knew that there was a need for naturopathic medicine in this community. And I am so glad that I took that leap because I have since January been able to help so many women who are in dire need of some answers for their health concerns. I primarily help women address the root cause of their fatigue because most commonly I'm working with moms who have put themselves last. And now they're like, oh my gosh, I can barely function as a mom or get all the things on their to-do list done. And there's usually an answer as to why they're so tired. So by looking at their hormones or their thyroid or their adrenals, I'm likely able to come to the conclusion as to why they're so tired and be able to get their life back so that they can have the family and the family time and do all the things on the to-do list and not feel like they're absolutely going crazy, because life's too short to feel tired. Like, some fatigue is normal, but to be tired all the time is not normal. And that's what I primarily focus on out here in Gilbert.
That's awesome and much needed service. I am certain of that. Talk a little bit about the difference between medicine and naturopathic medicine.
Sure. So I am licensed in the state of Arizona, primary care physician. We have a licensing at Naturopathic Medical Board, and it is very similar as far as education goes from a conventional medical doctor to a naturopathic doctor. It's a 4-year medical degree. The first 2 years is all basic sciences, just like a medical doctor does, like anatomy, physiology, biochemistry, etc. And then we take our first set of board exams on those basic sciences. And then the last 2 years of our education is all didactic work and clinical experience. So when I say didactic, I mean like we take a course in cardiology. So we learn all about the heart and how a medical doctor will treat, say, high blood pressure, and how naturopathically we can do that by abiding by various principles, like looking at the whole person, getting to the root cause of disease, giving your body what it needs to heal on its own, prevention, things like that. Are what the foundation of naturopathic medicine is. So we have been raised in a society where we go to a doctor and get a pill for our ill. And there's an underlying reason why you feel the way you feel. And that's the beauty of naturopathic medicine. I can really uncover that root cause and then give your body what it needs to heal, so you don't have to take the pills and have essentially that Band-Aid effect.
Yeah, so if I'm established with a physician currently and I think that I want to come explore some of your services, what does that process look like?
That's awesome. I love working with it, the integrative medicine side. So I'll review labs from a different provider and give a second opinion. Oftentimes those are very incomplete as far as what I like to see. So we'll do additional lab work. The first initial appointment with me is 60 minutes. And most people only see their doctor for maybe 10, if they even see their doctor. It might be the PA or the MP or the assistant. They actually might not see the physician for more than 2 minutes. So I spend 60 minutes with my patients face to face on that initial visit, really getting to know you as a whole, going through your entire health history. And then oftentimes we're going to have to do some additional lab work because I deal a lot with hormones. So we time that with menstrual cycle, etc. And then we meet back after the lab work is done and go through the labs, and I explain why I ran them, where you are in this silly range of normalcy, if you're on the high end or the low end, and then provide you a treatment protocol, whether that's dietary recommendations, supplement recommendations, lifestyle recommendations, or even prescription medication if indicated and necessary. I would say probably my most two commonly prescribed medications are thyroid medicine and bioidentical hormones. So that's pretty much the process. And then you just get your life back. You start feeling better.
That's awesome. I'm going to say it's such a significant point to know that you pour an hour of your time into your patients, because women give so much of themselves to everybody else. And it's hard sometimes to find someone who just wants to take time to invest back in you and listen and hear some of the struggles that you're facing. So amazing. Kudos to you for taking time to do that and serve in that way.
Yeah. And that's so big because women just want to be heard. They want to be listened to, and they've oftentimes been dismissed by other doctors and just said, oh, well, you're just a mom, or, oh, you're just depressed. And they're like, but I am not. Like, I don't feel well. So I like that. That's why I named it Hope, because I want patients to feel the hope that their symptoms are real and they're not crazy, and that there's hope that they can feel better.
Wonderful. Last question for you.
Yeah.
Why Gilbert?
Why? Well, I kind of mentioned this in the beginning. I love Gilbert. The town of Gilbert is awesome. It is booming. I remember back in the day, it was just, very farm-like, and now it's like more, I mean, it's like a little baby Scottsdale down in downtown Gilbert, which totally different vibe, way more cooler, I think. And the population down here needs naturopathic medicine. A lot of families, a lot of moms. That's my ideal patient base. So that's why I came out here, because it's blossoming, and there's not a whole lot of naturopathic doctors in this community. So figured I would come out here and help people feel better.
Well, wonderful. Thank you for your investment in Gilbert, and thank you for providing such a valuable service to our community. And we're grateful to have you part of our chamber membership as well.
I love being part of the chamber. Thank you for having me.